Hello, thank you. Thank you for joining us today in this conversation with the county. My name is Rodrigo Garcia Reyes. I am a public information officer for the county of Santa Clara. And I want to welcome everyone who is with us today on our social media platforms, on Facebook, and our channel, on YouTube channel. We are here to have a conversation today about the state of COVID-19 in our county, and we want to encourage you to submit your comments and your questions on the comment section. And at the end, we will have a Q&A session or section rather to read your questions regarding this topic. We can we can get started with some general information that it's relevant. We are here to present to you the most relevant information about the state of COVID-19 in Santa Clara County. And we have a presentation for you, and we can get started. So we can go to the next slide. So our update to July 6th, up to this date, 81.9% of people 12 and older have had at least one doses of the vaccine. Let's remember that currently we have 3 vaccines available in our county, and that it's Pfizer and Moderna that require 2 doses. And we have Johnson & Johnson that requires 1 dose. So about 81.9% of people 12 and older have received at least 1 vaccine dose. And 75.3% of people 12 and older have completed their vaccination, which means they have received either their 2 doses of Moderna and Pfizer or the 1 dose of Johnson & Johnson. Up to now, our average on cases of our 7-day rolling average is 32 cases. We have seen a little bit of an uptick on the number of cases in our county, and we are monitoring that closely, but still our numbers continue to remain low. We can go to the next slide. Here, we are showing some of the demographics for the number of cases in our county. When we see the cases by age group, we can see that the big numbers are happening among people who are on the younger side. We see the largest is between ages 20 to 29. We have about 19.5% of all the cases. In terms of cases by gender, we see that it's pretty much equal between male and female. But what it is important to highlight here are the cases by ethnicity. So Latinos are 25.8% of the Santa Clara County population. However, we make up 50.3% of total COVID cases. And we can go to the next slide. In this case, we are looking at the COVID vaccination rate in our county. And again, just by contrasting what we see in the number of cases, which is pretty high still among Latinos, when we look at the vaccination rate by by demographics, we see that residents ages 12 and older with at least one vaccine. We see a very high number among our older population, which I think it's fantastic because it's a very vulnerable population. And then we moved into the rates by ethnicity. And we here see that our Latinx population are still not quite where we need to be. We are still on the 60.9% of people completely vaccinated. Again, to remind folks that completely vaccinated means that if they receive Pfizer or Moderna, that they received already the two doses. Okay, if they received Johnson and Johnson, they got the one dose. Now, something to highlight here is that we've seen also a dropout rate that is concerning to us, which means folks who received the first dose of Moderna and Pfizer are not coming back for their second dose. This is extremely relevant because with the new variant, the Delta variant, which is more infectious and it can be transmitted more easily, only the people who are fully vaccinated, which means they have completed their two doses and are 2 ways after the second dose, are fully protected. We can go to the next slide. We remind folks that currently all individuals ages 12 and older are currently eligible for a vaccine in Santa Clara County. Folks can visit our website, sccfreevax.org, or call 211 to schedule an appointment. And great news today. We have been giving away 2 free concert tickets, or let me take that back. We have been conducting raffles every week, and there are people who are winning 2 free tickets to go to concerts like The Weeknd, Bud Bunny, or Justin Bieber. So those were the feature artists for this week. And here on the screen, we have the winner number, and I'm gonna let you take hold on that for just a few seconds while you write down and check if you were the winner. Okay, folks. So make sure that you check well the numbers, and remember, every week until the end of this month, we will be doing these raffles, and we will announce the winners of these free tickets. And all you need to do, if you haven't gotten vaccinated, is just go to the sites that are participating. Those include Overfell High School, Santa Clara County Fairgrounds, Emmanuel Baptist Church, Gilroy High School, Valley Specialty Center, and Mountain View Community Center. And really important, if you have been vaccinated, you can bring a friend or a family member who has not been vaccinated, and you both can enter the raffle. Next slide. For next week, we will be raffling prizes to see Harry Styles, Mark Anthony, Evanescence, and Hailstorm, and Los Bookies. Next slide. This is the list that you can also find on our website, secfreevax.org, and includes the vaccination sites where you can make an appointment or go without an appointment. And there are all over the county, and they're available for you. Remember, vaccines are free. You do not need a prescription from your doctor, and your immigration status is not a problem. This is regardless of your immigration status, or even if you have insurance, medical insurance or not. Vaccines are available to everyone 12 years and older. Next slide. Here it's a list of more places. And these are getting updated every week, so you can always check back on scfreevax.org. Next slide. Here are some resources that are helpful for you. And we can go to next slide. If you have any questions regarding COVID-19, regarding vaccination, you can always call our call center at 211. You can also call 408-970-2999, or you can send a text message at COVID-19 to 211-211. And this is if you have any concerns, if you have symptoms and you don't know where to go, or if you just have general concerns, if you want to find out where you can get tested or vaccinated, or you want to make an appointment for your vaccine, these are the numbers that you can access. And I believe that's the end of our presentation. Thank you. And now we, as every community forum that we hold in these conversations with El Condado, we have a very special guest. And our guest for today is the Consul General of Mexico, Alejandro Bologna. Consul, thank you very much for joining us in this conversation today with our community. How are you doing today?
Hello, good afternoon. Thank you, Rodrigo, for this invitation. It is a pleasure to me to be with all of you and talk about COVID and the importance of vaccines.
Thank you. We are pleased to have you. Thank you for joining us today. We want to start by inviting people to send us your questions, and at the end of the presentation, we will be hopefully reading all your questions, and we will try to answer to the best of our abilities. Consul, I wanted to ask, just as a starting point, if you can tell us about what has been the impact of COVID or that COVID has had on families living here who have dependents living in Mexico?
The impact has been terrible for everyone, people living here or also in Mexico, because it has been really a tremendous negative effect of this disease. Very contagious, and at the same time, with a lot of people that unfortunately passed away, and other ones that still have some effects of this disease. They have also symptoms, or they are in rehabilitation process. What we do here at the consulate is that we help all the Mexican families or Mexican Americans that they request our service, and in different ways that we can help oriented and attend their needs. First of all, as you know, we have supporting all Mexicans living here that they request a specific situation, being with COVID or also with some familiar that was being affected of COVID. So we gave them the whole information, and depending on each case, we support the person or the family. Also, we have some resources, but it depends on the situation of each family and the conditions that they are. So we make a specific study, and regarding that, we can determine if there is another kind of need or action that we can take. We support them with the documents that they need, and we also support them if they have some member of their family that passed away and they want to send him or the person back to Mexico. We also help them with all the procedure so they can get the permits, and the body or the sons can arrive in destination.
Thank you, Consul. If I can ask you to elaborate a little bit more on this last part that you mentioned. What if someone has a member in their family who passed of COVID? What can they expect if, I mean, in terms of help? What can they expect, or what resources could they be able to access through the Mexican consulate here in San Jose?
Yes, the first thing that we tell them is to call us, to call the consulate or come to the consulate. They don't need any appointment for having assistance on the protection department. So the first thing that we recommend is the person that has a family affect or they also are affected by COVID, that they can call us at the consulate, or the family members can come here at the consulate, and we will give them all the information that they will need. The information with the different programs that the county and the cities has where they are living, that they can access, but also what we do in Mexico. If they request a specific need, so we help them. If unfortunately some of the family member passed away, what we do is giving all the papers that they need. For make any body transfer or the bodies arrive into our country, they need some health certificates and also some permits. So we do that procedures here at the consulate. What we need is they need to come, they need to bring the death certificate, and we process the documents with this information. If there is another situation, for example, if it's a person that maybe they don't have the members here, but he was working and he has some belongings here, and also in case that they need. So we help to call families in Mexico. We help them to know what's happening and oriented them. And also in case of, for example, they have some family members here that they don't know, and they want to inform their loved ones that they are here with some specific situation. We also help them to connect with their families members.
What a great resource, particularly in these difficult times. And the fact that in our county we have a big population who have these binational relationships, people who migrated here from Mexico, who left their family back in Mexico, or families who grew up here but still have relatives in Mexico, or people who grew up here but marry someone who is from Mexico, etc. All these combinations, but it's wonderful that the Mexican consulate is able to assist people with these kind of resources. Now,
yes, and also what is important is what we have seen is most of the times they connect directly with the different companies that make all the procedures, and sometimes they are not well informed, and the charters come higher, and higher. So that's why we also recommend and we assist them to give them different options that will be more cheap, and also we sometimes can give some small resources just in the case of families that are really in vulnerability conditions.
yeah, that's fantastic. Thank you very much. Just to make a parenthesis, is there a place where people can call, a number they can call, or a website where they would be able to connect?
Of course, they can also website, go to the page of the consulate. They can call also call to the phone number that is 408-856-2840, extension 121. Or we have also general phone number. It's a central, like a call center that operates 24 hours a day, and it's the SIAM. It's 520-623-7874.
And let me repeat those numbers. The number locally is the 408-856 2842, extension
Sorry,
121.
40.
40. Thank you. So the number again, 408-856-2840, extension 121. And there is the 24-hour call center, which is 520-623-7874. Is that correct?
Correct. And those phone numbers are exclusive. That extension on the phone number is for things that has to be or deal with protection issues, not just for appointments for have their passport. It's when a person has some problem or it in certain vulnerability, so we can assist him or assist her as soon as possible.
That is great. But again, particularly in these difficult times where there is so much tension and anxiety of the situation itself, someone might find themselves in a situation that they don't know what to do, where to go. And I think offering these options for people in those vulnerable situations, it's fantastic. So just to remind the audience, you can call the local number 408-856-2840, extension 121. And you can also call the 24-hour call center at 520-623-7874. Thank you. Thank you very much. Now, here locally, what have been some of the efforts that the Mexican consulate has um, has done to serve the community locally?
Well, first of all, I also want to thank the County of Santa Clara because we have been working very close to have, before the vaccines, to have the test of COVID to our Latin community. And as the vaccines came uh, available, then we have had about 5 more or less journeys of vaccination here at the consulate. And I think that it's very important to our people that they will feel, sorry, that they will feel comfortable coming to the consulate because they can do it in their language. They know that are safe. They know that is not going to be any consequences for coming and getting the vaccines. But also we have been working the whole time here at the consulate, first with a small amount of persons that could come to the consulate to use their documents. Now we are open at the 100%, because we know that, for example, the matricula consular or getting a passport is a first way of giving protection to our community. We know how important it is to them to get their documents, and the only place that they can get their documents, their ID documents, is here at the consulate. So we work on with very close with the County of Santa Clara to keeping all the safe security measures, but staying open, attending, assisting our community. And we also develop different programs through websites, so keeping our community informed about different uses, the different programs that we have here at the consulate, but also with the specific information regarding the COVID, the different programs that the city of San Jose and the cities that are in our jurisdiction, and also the county of Santa Clara, that put available to the community, either regarding their migration condition, so they can access to different resources and different situations, so they can, since, for example, paying the rents, that they were different programs to help them during this specific period, or credits for their business, or work, different programs, getting some money back through taxes and other dispositions, so they can be sustainable during these critical months where the COVID was affecting more. And we know how our community was affected about this virus. Unfortunately, our community, we know that there are couple, 3, 4 more families that live in the same home because it's very expensive to get a home alone, and all these situations complicate and put them in a more vulnerability situation.
And recognizing that a lot of the essential workers are also part of our community, and we're talking about, I mean, during the shelter in place time, the people could still go purchase groceries, and folks who were at these places working, a lot of them were from the Latinx community because they didn't have an option to stay at home and work from home. Also, there is a need to, because they, a lot of this time, a lot of times, these families have to care for their families living here, but also back in Mexico, and taking time off is not an option. So there are a lot of disparities that are needed to be addressed. We've seen with the farm workers where they didn't stop because we needed to have food at our table, and these people, they needed to continue working, and a lot of these folks are, coming from Mexico, and they needed to continue working. So it is It is great to hear what the Mexican consulate is doing to assist uh, the connationals that live here, and also in a way assisting the families that are still living back in Mexico. Now, Consul, you mentioned something about the passports, for example. Have you seen any trends in terms of travel from either side, from people traveling from United States to Mexico or vice versa?
We don't have those statistics. What we do is using the documents, not necessarily because they need to travel. We know that some of the passports are needed because they have their children that they have been born. The children are American citizens and they need their IDs for getting also medical situations. If they kids need specific situations or medicines or appointments, and sometimes they are requested to give also an ID document. So the documents that we use not necessarily are statistics because they are flying or going back or coming from Mexico. So what we do, we have sometimes also the people they need it because they are already in an immigration process and they need valid use passports. So that's why for us it's considered not the fact of getting a passport for traveling. It's also for us it's an ID document as it is the matrícula consular. For example, for getting a payment or a check at the bank, they will request or the bank will request some ID documents. So the only documents that they can get is or the passport or the matrícula consular. Also for getting the driver license they will need the matrícula consular. So that's why it's important for us for assisting our community because we know that they need those documents just for being here, just for living daily.
And speaking of essential workers, the Mexican consulate didn't close during the shelter in place, right? You still had your services running, and the people coming to work to be able to offer all these services to the community.
Of course, and I want for a profit this time to recognize all the hard work that essential workers, most of them Mexicans, have done during the pandemic and during their life because they are an important support for the economy here in the county and the whole country. And we know the difficult conditions where they were working through, but as you mentioned it before, it's necessary to them to get the daily payment for keeping safe their families. So, and also they have this responsibility that they know that they are serving the community, that they know that it's important what they are doing at the supermarket, at the food court, or in other places, and keeping or taking care of kids and serving in restaurants or serving in other areas. So our people, it's really strong workers, very responsible in fields. We know how many Mexicans are working there in the fields, and they keep working the whole period in difficult conditions, but they keep working. So my recognition to all these people that is in the front line working.
Likewise, our recognition, our admiration, and we're very heartfelt thanks to all the essential workers, the farm workers, the clerks, are all these government offices, and people working at the grocery stores and all these other places in janitorial services, in health services, first responders, all these people that did not stop working during the worst times of the epidemic. So thank you to all of them, just like you mentioned it. In regards of the services that you have provide in bringing and making vaccines accessible to the community, what has been the response from the community in coming to the Mexican consulate to get vaccinated?
Well, the first journey, we have a lot of people coming. And what was important is that we were open not just for Mexicans, it was open to every member of the community. And really, we have a great response for the first, we can say, the first third journeys that we have about almost 500 people vaccines each day, each journey. What we have seen now is that is less the number of people that has been vaccines. Well, in general, as you mentioned in the statistics that you showed before, is that if a lot of people, maybe more than 70% here in the county has getting almost one vaccine, the difference with our community, a Latinx community, it's really a big one because there's a gap. I think it's no more than 60% of our community has getting the vaccine. So I think that it's very important to communicate our community, our connacionales, that keep going. There are a lot of places where they can get the vaccines and try to do it because it's a way to keeping them safe. Uh, what has been told before, there's the virus, still the COVID-19, they have some variants, and the only way to keep more safe their families is through the vaccines. So if could be some concerns about uh, effects or negative effects, I think it's important to them to talk to their physicians, or if they have any doubt, they can also call to the different centers that the county has set up for giving information to our community. Because sometimes it's what they hear and not what is the reality. Unfortunately, is that the way? No, sometimes if they hear that someone gets ill, also he was already vaccines, but the difference is huge because it's not the same also getting the COVID with the vaccines that without the vaccines. The possibilities of not arriving to an emergency room with the vaccines are really high. So that's why it's important to get the vaccines and protect themselves and their families.
And that is, I thank you for highlighting that part, because yes, that is true. People who are fully vaccinated, which means they have completed either their first dose or their only dose of Johnson and Johnson, or the two doses of Moderna or Pfizer, and they have had already 2 weeks after the last two doses, they have a protection that it's not comparable to people who have not been vaccinated. And this is really important, because a lot of people say, well, so and so got vaccinated and they still got sick. But the big difference is, in the event that someone gets sick even after they got vaccinated, they will not end up in the hospital or in the ICU or even die of COVID, in contrast with someone who has not been vaccinated. So I think that it's a very important point to address. And we know that the chances of getting infected by COVID once people are vaccinated are low, but it's not zero. But what we know is that people do get the protection that prevents them from ending at the ICU or even dying of COVID. So let me ask you, Consul, what message would you give to folks, to families, and by the demographics that we're seeing right now, we see a lot of hesitancy, particularly from males, these adult males who are just don't want to get vaccinated. What message would you give to them in this case?
I can say is my recommendation is to get their vaccines. It's the safer way to get more immunity and to save lives, because we have seen how especially our community was affected with this disease. The number of persons infected, and also the number of persons that passed away, that died because of this disease, were a really big difference. And there were much more in the Hispanic community than in other social groups, in other racial groups. So that's why it is important to be informed, not just what spread people around the facts, positive or negative. Go to persons that are qualified, that can explain them all the doubts that the person can have for getting a vaccine. I got my vaccine and I really feel more comfortable working and doing my life because I know that I have more protection than other people. And that keeps us going ahead and returning slowly but faster than others to the normality.
Thank you. Thank you. And that's definitely true. And I will add to that that we live in a society where we tend to be more individualistic about it's about me and what matters to me. But in this case, I think it is important to highlight that we also have a responsibility with those around us.
Right.
Because if I don't get vaccinated and I get sick, I have a high chance to transmit the virus to someone who might be more vulnerable and would probably suffer hard and harsher consequences from getting infected. And I think that's where I would stress the message for folks who are still hesitant to think about not only you but those around you, your family members, your community. It is important. We cannot be thinking about ourselves because we don't walk in bubbles. We don't exist in bubbles. We are social individuals. And it is important to consider that. And something also to highlight is that, the efforts that all of us are taking on to bring vaccines to these vulnerable communities are not a way to impose or force people to get vaccinated. But we also want to make sure that those who usually don't have access to vaccines, they have it. And by doing this, we're providing important information and education, which I think it makes a difference in what people react regarding the vaccine. Anything else that you would like to add, Consul?
Of course, is continue inviting the community, our people. We know that sometimes they think that they can lose one day of work and maybe feeling a little bad the second day, and then they spread money that is important for them. But you need to think in the future. It's better to lose maybe one journey of working, but getting a security that could keep you with the health that will be necessary for continuing working and cover the needs that you and your family are looking for. And I will continue recommending the shot or the vaccines. I did it. I have already my two shots of Moderna, and just in the second application, I feel a little bad, but nothing that could be not affordable. So it's really my recommendation is that we have seen how many families were distraught, that maybe they thought that it was not important. They continue doing their life, and unfortunately, get one member sick and that member sick contagious everyone, and not just the loss of a lovely person, but it also could be some kind of guilty perception because of an action of a person of not being very careful about one situation, detonate a consequence of other persons getting ill, and maybe that feeling could be something that will not keep a person's in a better situation. So that's why it's important to think, as you mentioned it, in the community or social responsibility that we need to think about. We don't live alone, we live in a community, and we also have some responsibilities to have a better life for everyone.
Absolutely, absolutely, and thanks to the millions of people who are very getting vaccinated around the world, we are seeing the number of cases coming down, and definitely in Santa Clara County, we are one of the counties, or the main counties in the United States, with the highest rates of vaccination, and I want to applaud because of all the people that have taken the step to take action in stopping the spread, that this is something that cannot be done with one entity, but by the effort of the community. And it's showing, and it's showing to the benefit of those who are getting vaccinated as well as those who are not getting vaccinated. Because those who are not getting vaccinated are also less exposed now with the numbers coming down. So again, this the vaccination, it's a personal choice. We want to make sure that we provide the tools for people to stay informed and also provide access to everyone who decides to take this important step in protecting themselves, protecting their loved ones, and protecting their community. Thank you very much. We want to thank all the people who have been watching and following us on these community forums where we engage in these conversations with professionals in the community, hearing about the work that they do. We have a lot of resources available. We want to remind folks who want to learn more about the efforts that the county is conducting in regards to vaccination to visit our website, sccfreevax.org. That's one of the resources. You can always visit other official resources such as the CDC site or the World Health Organization. There are plenty. And avoid all these conspiracy theories that are going around that do not do any good for you. They're just taking bites on the computer in time of you when you're reading it. So get informed, make a decision based on true information. We respect all beliefs, and we recognize there are people that will not get vaccinated for different reasons. We totally respect that, and we just want you to know that we are here for those who do want to take that step, who don't know where to go, do not know where to get that information. And we also want to highlight the tremendous work that the Mexican Consulate has been doing in assisting the community before the pandemic, during the pandemic, providing all these important services, like you mentioned, in helping people with um, all the paperwork that people might require, getting an identification, getting a passport, helping families transport their loved ones who passed back to Mexico, and in general, providing all these resources. I want to remind folks that there are numbers available for to get in touch with the Mexican consulate, and that is 408 856 2840, extension 121. And there is also a 24-hour call center at 520 623 7874. I want to thank you, Consul Alejandra Bologna, for taking the time to join us in this conversation. Thank you for sharing all the information that you have. Thank you for leading the Mexican consulate, or the consul general in San Jose during these difficult times. We thank you very much. Please give our heartfelt thanks to all the staff that has been working with you through all these difficult times. Thank you very much. Please give them our appreciation for the work that all they do. And thank you to everyone who has joined us. We have these community forums every 2 weeks. Stay tuned on Facebook for more information. And with that, any last words, Consul?
Well, also, I want to you please give my recognition to all Santa Clara authorities, because you have done an extraordinary job to keep safe the whole community against COVID-19. Thank you so much for all your support, because we have been working very close with the county, serving our community. Without your help, it was going to be impossible to do what we are doing.
Thank you. Thank you very much. And thank you, everyone, for connecting with us here on our Facebook page and our YouTube channel. We'll see you next time. Thank you very much, Consul. Have a great afternoon.